Hello, this is Dr. Wilshire at Missouri Fertility, Columbia, Missouri. Today we're doing a procedure that you would not necessarily associate with a fertility doctor. Who we have here is a lovely 40-year-old woman with 3 children. Over the past years, many years, we've helped her have 3 children. Now what happens to a woman's uterus after she's had a child or 2 or 3? The placenta, which attaches to the uterus, leaves a little scarring, and sometimes the placenta can actually infiltrate or grow into the wall of the uterus and injure it. This can cause the lining of the uterus, called the endometrium, to grow into the wall of the uterus and create a condition which we call adenomyosis. Adenomyosis causes very heavy, painful periods in many women. The absolute cure for adenomyosis is a hysterectomy, meaning a surgery to take the uterus out completely. That's obviously a big surgery. It has risks, it has pain, and it has expenses. In properly selected women, there is an alternative to hysterectomy. In this nice lady, we are doing something called a hydrothermal ablation. We have first made sure there was no cancer inside her uterus and essentially cleaned it out. Second, we've put a telescope inside the uterus to look around, and we are currently inflating the inside of the uterus with sterile salt water. The salt water is going through a machine behind me here called a hydrothermal ablation unit, which is heating this salt water to almost boiling. This is 90 degrees Celsius or 200 degrees Fahrenheit. If I draw your attention to the TV screen, you can actually see what we are doing right now. This is a telescope in the cavity of the uterus. This is called the endometrial cavity. When we started, this cavity was red and pink from its blood supply. Now it is turning white, and it will turn brown by the end of the procedure. This is a 10-minute procedure. You can see the hot water circulating through the uterus and essentially cooking the inside of the uterus. It cooks or coagulates the inner half of the uterus, leaves the outside of the uterus alone. For women who are properly selected, who have adenomyosis or other disease on the inside of the uterus, this is amazingly effective. This will reduce bleeding and pain in 80 to 90% of women. There are some failures, but the vast majority of these women are very, very happy with the results. It allows them to avoid a hysterectomy. She will go home in just about an hour. She'll be in very little pain. She'll be back to normal activities tomorrow. So there you go. A procedure we don't do very often as fertility doctors, but something that we're highly qualified to do since we have a lot of experience doing hysteroscopies and operative hysteroscopies in general. So there you go. That is a hysteroscopic hydrothermal ablation for a woman who's done having children, having heavy bleeding, and does not want to have a hysterectomy. I hope you found that interesting. This is Dr. Wilshire, Missouri Fertility.